Welcome back to Healthy Living, brought to you by Tammany Health System. We're talking today about population health, and we learned a little bit about how population health helps us to take care of our community, and we learned about transitional care. Next, we're going to learn about annual wellness visits and how those can help out in the home. Welcome, Caroline Barkerding.
Thank you.
Glad to have you on our show. Now, Caroline, you're a nurse practitioner and you work in home care, but you are focused on something called an annual wellness visit.
That's right.
So maybe let's start at point A and describe that for us.
Sure. So the annual wellness visit is just a yearly exam with your primary care provider to go over your current health status, your risk factors, and try and develop a personalized plan of care. A big benefit of the annual wellness visit is most of the time it's covered free of charge to the patient by Medicare.
Oh, wow. Okay. So if you have this annual wellness visit, you may not even realize you're doing that. You go in for an appointment, you take care of the annual wellness visit, but there's a real reason to be doing that, and the value in that. I guess it's for people to understand why they should have a wellness visit. It's not just to check a box, not just to say you did it, but that really adds to longevity.
Absolutely. So during the annual wellness visit, what we'll do is we'll go over your past medical history. We'll discuss your family's past medical history. We'll go over what healthcare providers you're following with currently and whether or not you need to follow up. And we'll go over any medications that you're taking at this time. We'll go over what's called a health risk assessment, which essentially will just paint a picture of what your daily routine is, as well as your functional status. We also will do routine vital signs, blood pressure, height, weight. We also add in some extra assessments just to make sure that everything is staying on track. We do cognitive and memory assessments. We do depression screenings. We do nutritional assessments. We assess whether the patient is at risk for falls and other health measures.
Wow. So you really get a very full picture of each individual patient and have an understanding of their general situation so that they can try to stay healthy, and if they have chronic diseases, how to manage those well.
Absolutely.
Okay. And I know one of the aspects of what you're accomplishing is advanced care planning. So maybe you can talk a little bit about what advanced care planning is and how that relates.
Absolutely. So that's a big topic that we touch on during the annual wellness visit. So advanced care planning, we educate patients on living will and LA Post, which are just both documents that specify what the patient would want at the end of life if they were no longer able to communicate that themselves. We also really encourage patients to assign a healthcare power of attorney, which is essentially a person who is going to make medical decisions on the patient's behalf if they were no longer able to do so themselves.
Okay. So really, at the annual wellness visit, it's more than just your vital signs. Like you said, we're going to talk about your family history. We're going to talk about your current life and what's going on, because that helps us understand what your health situation is. If we have chronic diseases, we're going to talk about those and how to manage them. But then also to have a plan and a thought about, in the course of our lifespan, none of us likes to think about this, but none of us is getting out of here alive. We're all going to go sometime. And so advanced care planning is a really important way for us to do that in a manner that really puts some thought and planning into how we want our life to end and how we want our family to be able to be managed and supported through that process.
Absolutely. It's not the most fun conversation, but it's definitely necessary. Whenever you plan, advanced care planning and you put those documents in place, it really does take the burden off your family members having to make those really tough medical decisions in the event something does happen.
Sure. And obviously the time to do that in an annual wellness visit when nothing is wrong, that's a good time to be thinking about these kinds of things, because we can take facts into consideration. We can think about our family and what their needs might be, and we can sign that paperwork and put it away and then just not have to think about it again for maybe decades.
We like to review it at least once a year just to make sure that your wishes are still reflected in whatever documentation that you signed. So that's one thing. It's once a year you look at and you make sure that you're still happy with what you put down, and if not, we make changes.
there again, that's the annual wellness visit.
Right.
So now we are talking today about population health and home-based solutions that help us to achieve those goals. And you and I have been talking about annual wellness visit, which any of us can do with our primary care and should do with our primary care. But you actually have a new program that's taking the wellness visit home.
Absolutely. So there's a lot of advantages to doing the annual wellness visit in the home. It allows us to actually reach out to those patients and care for the patients that have trouble getting into that office. They could have trouble getting in either through debility or transportation concerns. We've even had patients that feel uncomfortable coming into the clinic through COVID concerns, and we're able to reach out to them and make sure they're getting the care they need.
Fantastic. So you're essentially taking that annual wellness visit that we talked about, and you are transporting it into the home environment for that individual and maybe their family member to be along, just like you would at the doctor's office. And the idea behind that being that you can see the environment, you can help this patient to have an awareness of what is contributing to their health and what maybe is a detractor to their health there in the home environment.
Absolutely, exactly. I think you get a better picture of the patient and exactly what's going on when you're in the home rather than in the clinic setting.
Well, and I think for a lot of us, we put on our calendar to go see our physician annually. Maybe we tie it to a birthday or some other trigger that tells us, okay, time for the annual physical. But in this case, you're talking about a special population of people who qualify for home-based care. So can you talk a little bit about how people can access home-based wellness?
Absolutely. So any patient that is due for their annual wellness visit through Medicare, they're all eligible for the annual wellness visit in the home. Usually they're referred by their primary care provider. They can also call their primary care provider at St. Tammany and request to be seen in the home rather than in the clinic setting.
Okay, so it sounds like it's a Medicare-driven program.
Yes.
So anyone who's Medicare eligible or already a Medicare patient has access to this.
They do.
And they can choose to do that through their established primary care provider, or they can contact our office, and they can do that on the website or at the office.
Absolutely, yes.
Very good. Well, I think, we're talking about something that all of us sort of take for granted, annual physical, but we're talking about it in a way that really defines how that physical keeps us healthy, helps us to manage a disease we have, or maybe keeps us from developing severe disease at all, and hopefully keeps us out of the hospital.
That's our goal, absolutely.
Outstanding. Well, Caroline, thank you so much for coming in. It's been a pleasure to have you here.
Thank you for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we were talking today about population health. We also examined some home-based solutions that help us to take care of individuals throughout our community. We'll see you next time on Healthy Living.